When little ones are growing up, they face so many milestones, it's hard to count. In this episode of Being Well, we'll sit down with Carle Pediatrician Dr. Jonna, and she'll share how to more easily walk your kiddos through some of life's more challenging milestones.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for this episode of Being Well. I'm your host, Lacey Spence, and today we are talking about our smallest patients. We are talking about pediatric milestones. And today we've got a new guest on our show. We've got Carle's Dr. Jonna. Welcome to our show.
Hi, thank you, Lacey.
Of course, we're so glad to have new guests on. And being a new face, can you please give us a little bit of background on who you are, how you ended up being a pediatrician?
Definitely. So, I'm a pediatrician at Carle in Champaign. And basically I always knew that I wanted to be in medicine. And then when I was in medical school, I realized how much I enjoyed working with children, and that passion has stayed with me, and that's why I became a pediatrician. And I'm still very passionate about working with children and being an advocate for children today.
Definitely. Now, does it kind of, your mindset shift at all once you have kids and you're a pediatrician?
For me, yes, actually, it did. Yeah, I do feel more qualified to be giving advice since I do have children of my own. Of course, you can be an excellent pediatrician, and if you don't have children, there's lots of medical knowledge that is needed in order to do the job. But I think you can relate maybe a little differently to a parent when you have children of your own.
Oh, sure, because that's me out here without kids, and I'm like, oh, I think you should do this, and parents are like, yeah, right. Wait till you try it.
Yeah, they might trust your judgment a little bit more once you've been able to apply it yourself.
Awesome. Well, today we're talking about pediatric milestones. So why is it important to kind of address this, I guess? Because when children are going to the doctor for the first time, I mean, it can probably be a little intimidating for them.
It can be intimidating, yeah. So we want to make sure that families are well informed about what they can expect when they come to the office and to the clinic, and that they can pass that information along to their children depending on what age that the child is, because that can just make them feel more comfortable and can relieve some of the anxiety that's associated with going to the doctor's office.
Perfect. Well, I think at least for school age, maybe one of the biggest first things that comes to my mind would be the school physical.
Yes.
So can you tell us a little bit about the purpose and then what we should expect?
Yeah, so the school physical is an annual physical that is basically looking at the child's overall health and making sure that they are meeting any developmental milestones that they should be meeting, and that if they have any chronic illnesses, that they have all the supplies that they need to manage that, and that those illnesses are being well controlled, so that they are able to succeed as much as possible. when they're at school and in the school environment. So yeah, that would just be your yearly appointment, and we also make sure that kids are growing like they're supposed to be growing, that they're gaining enough weight, that they're growing tall like they should be, and a lot of times it can be an exciting appointment for the children.
Now, let's say I'm a new parent and it would be my first time bringing a child in. If you were to spot a condition that needs to be like monitored at school, can you give me a couple examples of what those might be?
Yeah, so I'd say the one we most commonly see is asthma. So when kids are in school, we want to make sure that they have all the medications that they would need to manage that if they were to start having any trouble breathing at school. So we would come up with a plan, and we would give that plan to the school, we would give that plan to the parents, and we would ensure that they have the medications that are necessary to make sure that they are safe and healthy. But that would be one of the ones that we see more frequently. Obviously, even things like seasonal allergies can cause issues if, you know, a child's having to constantly get up and blow their nose throughout the day at school. So we want to make sure that those symptoms are well managed, so that they feel comfortable being able to sit through their school day and learn.
And what about diabetes? Is that a big one too?
So we do see diabetes in children. Most of the children who we see with diabetes, there is a very strong family history of the illness. So we, in some kids, will screen for diabetes, even when they're not having active symptoms, and that's something we would determine at the visit based on their family history and what might else be going on with them and their health. And if they do have diabetes, then yes, it's very important that they are being managed correctly so that we keep them as healthy as we can.
Right.
Yeah.
Keep those sugars regulated.
Exactly.
And,
yes.
I mean, that's a lot of pressure to put on a little one to try and keep track of, you know, do I feel like it's high or low, or trying to check the blood sugar.
So depending on the age of the child, we manage it differently. So in the young children, obviously a lot of it is up to the parents. They tend to kind of estimate like, oh, how much do we think that they're going to eat for lunch? And then they, you know, can dose their medications or their insulin based on that. When it's up to, you know, when the child gets to an age, which is different for every kid, where they're responsible enough to do it themselves, then we do work with them quite intensely to make sure that they are managing it appropriately and being safe while they're doing that.
Communicating with those teachers to make sure if there's a birthday party snack day, like we're aware, so we can plan for that.
Communication is the most important thing.
And then I'm sorry if it's a dumb question. Again, my non-parent hat on over here.
No, not at all.
If my child, I bring them in and they are either like below the average size or above, what are my next steps possibly?
So yeah, so we would address both those issues. Basically, we look at children usually compared to where they have been before. So if you have a child who we see, like you said, below, so they're dropping down their weight across, as pediatricians, we look at percentiles. So if they're dropping down across the percentiles, going off of the growth chart, then we do become concerned. The first thing that we would do would be to see if, hey, does giving them more calories throughout the day and making sure they're getting enough calories just turn that right around. For most people, that is the case. They're just not getting quite enough calories, which I'm sure, as most parents know, can be somewhat easy to do in like a toddler who's running around the house.
Right, burning that energy for sure.
Burning all that energy. And if that doesn't solve the issue, then we look into other possible medical causes. If a child is in the overweight or obese category, then we will also address that, mainly talking about how do we become more physically active. We like to see children of every age get at least an hour of physical activity every day. So we'll come up with ideas of how to instill that in the household and how to get kids moving. Sometimes in Illinois that can be difficult when it's winter or when it's 100 degrees outside in the summer.
The park doesn't feel quite like an option.
No, it doesn't, but we'll come up with ideas of, you know, what they can even do in their homes or in their apartments to help with that. And then we'll also talk about nutrition and portion sizes and kind of discuss what can be done as a family. We never want to kind of like single out a child as having to eat differently than their family, because that doesn't work very well. And
it doesn't breed a good relationship with food.
It doesn't, and it can be hurtful to that child, and that's the last thing that we want to happen. So we will talk about kind of lifestyle modification for the entire family.
Because little ones are always watching.
Yes, they are.
Awesome. So we've covered that pretty well. Another topic that can be pretty personal depending on each family, but talking about like the shot schedule.
Yes.
So can you give us a little overview of maybe what is the typical shot schedule?
Yeah, so we kind of have all the shots broken up into kind of like your infant vaccines, and then you'll get vaccines again before kindergarten, and then usually again before 6th grade. So with the infant vaccines, you'll get those at 2, 4, 6 months, and then every clinic does it slightly differently because there's a little bit of variation in when you can give the booster shots. But then where I am at Carle, then we do 12 months, 15 months, and 18 months. And then you're kind of finished with your primary series of vaccines after that. And what those vaccines would cover would be things like tetanus, polio, diphtheria, and then certain bacterial infections that we don't want children to get because they cause bad illnesses such as meningitis and pneumonias. And then before kindergarten, you'll get boosters. You'll have 2 shots that are boosters from the vaccines you received when you were a child, and then before 6th grade is when you'll, here in the U.S., get your first meningitis shot and another booster of your tetanus, because that one, you know, we like to give every 10 years, even if you're an adult. And then we also do the HPV vaccine at that time as well. In addition to those kind of schedule of vaccines, we do recommend the flu vaccine yearly for everybody, and we also recommend that everyone be up to date on their COVID vaccine as well.
And let's talk about that a little bit. So we're taping this in the summer of 2022.
Yes.
I believe some data just came out that they're allowing the shots for children. Can you talk a little bit about making the decision of whether to vaccinate your child or not?
Yes, of course. So yeah, it just became approved by the FDA for children 6 months to 5 years old to receive the COVID vaccine. 2 different vaccines were approved, both the Moderna and the Pfizer. And both of them are efficacious, so really it's kind of up to the parents on which one they want to use for their child if they get them vaccinated. The Moderna one for that age group would be 2 vaccines 4 to 8 weeks apart, and then they would be considered fully vaccinated with the idea that there will likely be a booster that comes out later and gets approved. For the Pfizer vaccine, it's 3 vaccines over the course of 3 months, and then they're considered fully vaccinated. And we do recommend the COVID vaccine for anyone who is eligible, so that includes those children in the 6 month to 5 year age group. We have seen a lot of detriment to the community on those kids not getting vaccinated. I'm sure any parent who has their child in a daycare setting knows how frustrating it has been to have consistent childcare during the pandemic. And if we have enough of those kids vaccinated, those kind of quarantine and isolation rules will change in those daycares, which makes a big difference. Also, it's been shown to reduce the severity of illness when kids contract the COVID-19 disease, reduce their risk of hospitalization, and reduce their risk of death. And it's is not necessarily the best at making sure you don't get the illness. Kids can still get COVID if they are vaccinated, but what we're most worried about is those severe side effects of the illness, which we do see that it's very good at reducing. And then a lot of parents will say, well, you know, we know that COVID's not as bad in kids as it is in adults. And that's true. And that's a really good thing that it hasn't been as bad in kids as it has been in adults. But it is still the infectious disease that has caused the most deaths in kids in the last 3 years. So that is one that, you know what I mean, we don't want any child to die from COVID.
Most definitely. And in addition to that, we'll also, of course, add the yearly monikers of, you know, don't touch your eyes, ears, nose, mouth. Make sure you wash your hands. Like the good hand washing, I think
That's key, yeah.
very, very much tops the list. So I think we've covered the shot schedule pretty well. And we should probably move on to if a younger patient has to go through a surgery. That is maybe even more intimidating than getting a shot, going to just your yearly physical. So how can you well prepare your child?
So yeah, the most important thing when preparing your child is being open and honest with them. Kids figure out pretty quick whether they can trust what you're saying if you're being honest or not with what's going to happen to them when they go in. So the best way to reduce anxiety is to be honest. Not saying you have to give every detail, but just kind of a brief overview. So when kids go into surgery, I mean, you can kind of go through the steps of what that will entail. So you could say, hey, when we walk in the building, we're gonna check in, we're gonna wait in the waiting room, a nurse will come get us, she'll take us to a room, you'll have to change out of your clothes, put on a hospital gown, you'll get a cool little bracelet with your name and birthday on it.
Try and really sell
try
it.
and make it as exciting as you can. Yes. And, you know, basically they'll take your vital signs, they'll talk to you, ask you if you have any questions. And, you know, it's good for parents to tell their children, hey, if you do have questions, you know, ask. Feel free to ask the nurse. Feel comfortable doing that. Or, you know what I mean, the surgeon will come in at some point. You can ask them. And they can let the kid know, hey, you know, when you get your surgery, they're going to make sure that you're sleeping during that time. And they'll make sure that you're sleeping the whole time, and they'll make sure that you wake up at the right time. And the doctors who's going to help you do that is the anesthesiologist. And a lot of times the anesthesiologist will come in and introduce themselves before the procedure as well. And, you know, there are some kind of scary ideas that go into getting anesthesia. So a lot of kids know that they might need to get an IV. So
Quick poke. You know, it's not going to be painless.
It's not going to, it's still going to hurt, but it'll feel like a poke. And it's an important little straw that goes in your body and gives it water and medicine. And that it's your job to just be as still as a statue, as still as you can when it happens. And it can be really helpful if parents are calm during that time as well. And
which can be a challenge.
I know, well,
My baby.
exactly. I mean, we understand. But yeah, anything that you can do to help keep your child calm is very helpful. And then other times it's a mask that they get the anesthesia drug through. And then we like to say, just take big deep breaths, pretend you're like blowing out birthday candles, and that can kind of help give them the idea of how big of a breath they need to take.
And I love hearing you use the language, because I'm sure that's kind of something across the board, is that you are trying to cater to these younger folks to, you know, help put them at ease, not gamify it per se, but make it fun, that you're a brave patient, and that you're going to get through this, you know, stronger than ever. It's got to happen, but, you know, so proud of you. All that good language, encouraging language.
Yep. And that's, the best way to go about it. Yeah.
And so our next topic, it's always fun when you're expanding the family.
Oh, yes.
So as we are planning for our current child to welcome a new sibling, let's kind of go through the age ranges of how to kind of introduce this idea that you're not going to be the only one around the house anymore.
For sure. So, so kids react differently to the addition of a new sibling, and a lot of that can depend on their age. So if you have a toddler who's under the age of 2, they're obviously not going to understand or be able to anticipate a whole lot of what's going to happen when that new sibling joins your family. But a good way to kind of bring the idea in and to teach them about siblings and what a new baby is to use picture books. So yeah, we do recommend using picture books, ones that mention new baby, or hey, you're gonna be a big brother or a big sister, and this will be a little brother or a little sister, and just so they can kind of understand what is going to happen when that new baby comes.
A little bit older child might have a better grasp on what's going to happen.
Definitely, yeah. So they usually do, and they can sometimes even have, more feelings about it the older that they are.
So you just got to play that one by ear for sure.
So yeah, the preschool age child, it can be really helpful for them to see kind of concrete items that are associated with the new baby. So even if you brought them shopping to go get some of the new baby's clothes or some of the supplies that you needed, that can help them feel a part of it and a part of the excitement of bringing that baby home. And they'll also have a good idea, as your stomach is growing, that, the baby is growing in there and that we're going to meet the baby at some point. And you can tell them as well that the new baby is going to be it's going to be cuddly, it's going to be cute, we're going to want to give it hugs and kisses, but it's also going to cry a lot, and it's going to require, attention from mom and from dad, and so kind of preparing them for that can be helpful. And really, no matter the age of the child, when you do have a new sibling, it's still important for the parents, when they can, to set aside time to be with the older sibling, just one-on-one. So if mom can have a time to do that, if dad can have a time to do that, then that can be really helpful in the transition of welcoming a new sibling.
And is there anything general that we should be doing around the home to prepare as well?
I mean, we just recommend, that you have what you need in time for when you think the baby will arrive. And a lot of times, if it's a second baby, it can come sooner than that first one. So being prepared for that. Obviously, if it's a sibling, a lot of families do have a lot of the gear kind of already that they need, but just making sure the baby has a place to sleep that's safe, and that the home is clean. Yeah.
Well, let me interrupt in our last couple of minutes here. Why is it so important for us to early build a healthy relationship between our children and healthcare workers?
Yeah, so we always want that relationship between children and the healthcare worker to be a positive one. And we want to try and instill that from an early age. And really the most important thing behind that is that we want children to use the healthcare system throughout their lives to better their health outcomes throughout their entire life and even into adulthood. So if we can start that good relationship early on, then that will be helpful towards that goal.
Sure. And for first-time parents, as children are kind of building up their immune systems, it kind of seems like, especially if they're in that daycare setting, they're always picking up something, a runny nose, a little bit of fever, a cough. At what point should I be bringing my child in? And at what point are you you could stay home and maybe just hit the acetaminophen or whatever?
Yes, exactly. So when kids start daycare, in the first year, we do expect them to get about 2 viruses a month throughout that first year, yes. And a virus can last up to 2 weeks. So, I mean, really, your kid can be sick for about a year, and that would not be unusual. But anytime that a child is having any trouble breathing, we would need to see them right away. If a child is having a fever that's lasting longer than 3-4 days, they really need to be seen as well. But as long as you're giving the acetaminophen, giving the ibuprofen, and the fever's going down, and your kid is happy and playful and eating okay and drinking okay and doesn't seem too affected by the symptoms, then that's fine to stay home. Yeah, and kind of ride it out a little bit. Yeah.
So as we're in our last minute or so, is there anything else that you'd like to share with our viewers that you think might be helpful? I don't know if there's any words of wisdom or any this is going to be so golden for this parent to know.
I mean, basically just, I can't stress enough just the importance of, just going to your checkups, and if you have a question, ask. There's nothing wrong with when you go to those checkups. If you have anything you're worried about, just ask us. We've kind of seen and heard it all, so we would rather that you leave comfortable with all your questions answered than leave kind of wondering, hey, should I have brought this up? Should I not have? We just, want to be a resource for you. And even if we're just providing reassurance about something, that's a big part of our jobs. And that's, why we're pediatricians, is because we like working with families.
Yeah, you're there to support not just the patient, but also the parents.
Exactly, yes.
Wonderful. Well, Dr. Jonna, it's been great having you on today.
Yes,
thank you so much.
You. Thanks, Lacey. Yep.
Of course. And we hope that our viewers will join us for our next episode of Being Well.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.